Hello, I'm Dr. Annika Janson from Karolinska University Hospital and Karolinska Institute in Stockholm, Sweden. I've come to Pune to talk about the use of insulin pump in children with diabetes type 1. In my country, Sweden, we are using a lot of insulin pumps for children. I know this is not the case in India, and I will talk a little about the advantages that we have seen on using insulin pumps. Insulin pumps are quite costly and not always an alternative for many children with diabetes, but for some it is, and for them it can do them very, very much good. There are no clear evidence that insulin pumps are necessary for good metabolic control. I will show studies that tell that in patients that use pens can achieve just as good metabolic control as children using insulin pumps. But the advantages still are enormous if the child is able to get a pump because of convenience. We can use little doses, we can use repeated doses, we can use all the computer of the pump to work with the basal, reduce the basal, adapt to the everyday life. So the advantages are flexibility and an ability to be very, very precise when treating patients. When I treat very young patients with diabetes, patients below 2 years, I find it extremely difficult nowadays to do it without a pump because you need such minute doses of insulin for these children. What we do know, and where evidence is quite clear, is that early, precise metabolic control is of fundamental importance for the health of the child. As a pediatrician, I work with children that are maybe below 10 years when they get their diabetes. So hopefully they will live for another 50, 60, 70 years with diabetes. And we know from science that we need to be very ambitious from start. The old trials, DCCT and EDIC, told us that. Very good control from start will help the children to live happily with their diabetes. And the multiple dose of insulin, be it with pens or with a pump, are the main importance, the major factor contributing to good health for these children in the future. In my lecture, I will talk about a decision tree when we go into pump treatment. And the first choice is always who is the patient. So the patient will need to have a good knowledge of his or her diabetes, and the parents too. As you know, we only use short-acting insulin in the pump. So if the pump doesn't work, the child will be having DKA within a few hours, or risk of DKA at least. So if I have a child and I am transferring this child to an insulin pump, I will look carefully at the doses of insulin that this child has used in the recent days before switching to the pump. The basal insulin that this child has been using will be transferred to the basal program of the new pump. And the bolus doses that the child has been using will be, of course, the bolus doses of the pump. Often I start by using the total daily insulin and taking maybe 80 to 90% of that, since there is a clear hunch that the pump will deliver insulin a little bit more efficiently. So if you have a child who is in perfect control with pens, maybe you need to start with 80-85% of that total dose and then increase it gradually to avoid hypoglycemia in the first days. The way we do the profiling of the basal is, of course, a bit something you develop a skill over time, but my advice is to start with very few steps and a rather flat profile and then work from there. Most children will need very low basal during night, and then I increase it in day and typically increase it even more in the evening for a small child. To conclude my talk, I think as doctors we need to say that important is the insulin as such, and that we get our children to take their insulin doses and have as good metabolic control as possible. The way the children get their insulin. Is it a pump or is it pens? Is not the major importance. The major importance is the insulin as such, and that we get doses and metabolic control. As colleagues, I'm fortunate enough to work with patients that do not have to pay for their pumps in my country. So all pumps are paid by the government. Your situation is different. You work with patients who maybe don't have the resources to pay for the pump. And the most important message then is that we can achieve as good a metabolic control with an ambitious use of insulin pens. So the importance is the insulin, not the way it is delivered. Thank you.